We're lucky to have Robby here. Robby Stern, retired attorney, former lead lobbyist, special assistant to the president of the Washington State Labor Council, active member of PSARA, Puget Sound Advocates for Retirement Action, served as president for 9 years, and currently president of the PSARA Education Fund. He chairs the Social Security Works Washington Coalition and active in PSARA's fundraising RAGE. You'll have to explain that one, Robby, and climate justice committees. You're on.
All right, thank you. Just real quick, I have a law degree and I passed the bar, but actually I only practiced like for a year and a half. I was a pipe fitter welder for 11 years, worked my way up in the labor movement. Ultimately became, I was appointed by the president of the Washington State AFL-CIO to be the lead lobbyist and special assistant to the president, which I did for 15 years. But I actually come out of the labor movement, and my law degree helped me a lot in what I did. But I refer to myself as a retired pipe fitter welder myself. But either way, it's fine. Well, thank you all. This is really an impressive group. I'll just try to go through what we're working on real quickly. The first thing I want to bring to your attention is something that's happening quite immediately, and that is that the Republican House and the Budget Committee passed out a piece of legislation called the Fiscal Security Act, Fiscal Responsibility Act. Anyway, what it had was the creation of a fiscal commission. The fiscal commission is kind of based on what was the Simpson-Bowles Commission, except because they were not able to move the recommendations of the Simpson-Bowles Commission. They have reduced the number of members of each party that have to vote for the recommendations, but it's similar in the sense that the recommendations of the commission then move into Congress if there is agreement of the commission, and only 2 Democrats on the commission have to vote for it out of 6. They only 2 have to vote for the recommendation for it to go on fast track to the House of Representatives, where there is a limit of a 2-hour debate. There are no amendments. There are no points of order. And what that is for us is very clearly an effort to both cut Social Security and Medicare. And we need to be real clear. The Republicans are very clear about that. That's what they intend to do. So right now, we have to deal with this. And we are following the leadership of Social Security Works in DC that is working on this. The AFL-CIO just came out against the Fiscal Commission. But what the Republicans have done is that the Speaker of the House just recessed Congress until February 28th. In order for the government to keep running, there are 2 continuing resolutions that have to pass, one on March 1st and one on March 8th. The Republicans are going to amend the continuing resolution with the Fiscal Commission on it. And they're going to say to the Democrats, if you want to shut down the government and you don't want the Fiscal Commission, that's up to you. But we will not give the votes for the continuing resolution without passage of the fiscal commission. The intention that we understand from Alex Lawson and the folks in DC then is for the recommendations of the commission to come out in time for the lame duck session, and that therefore there will be no political cost to those members of the Congress that are leaving. And for those that are going to remain, there's going to be a long 2 years between the time they take the vote and the next election. So we are doing everything we can to try and kill the Fiscal Commission under the leadership of Alex Lawson. And for those of you who are in, and we should be very clear, this is a major threat both to Social Security and Medicare. So those of you who are interested, we have actually a webinar, not a webinar, a meeting of the Social Security Works Washington Coalition today at 11 a.m. when Alex Lawson will be there to update us since this new development, which happened yesterday, which was the recess that was imposed by the Speaker of the House, and what strategy is being used to try and kill the commission. So that is one thing that PSARA and our allies are working on, is to try and stop this fiscal commission. Obviously, all of us understand what they want to try and do both to Social Security and Medicare. What they want to do with Medicare is they want to make Medicare Advantage the default program for people that are going on Medicare. That's pretty well laid out in the Heritage Foundation policy program that they put out. They want to make major cuts to Social Security, include raising the age, the change CPI, and a number of other things. So just a heads up that this is going on. We will be talking about this today at 11 a.m. today and hearing what strategy is being developed in DC. In terms of our work on the corporate takeover of Medicare, I want to start by saying we think that we have anywhere from 2 to 3 years before the corporate interests have control of the Medicare system. They are growing. We haven't seen yet what the numbers are in terms of the number of beneficiaries that are in Medicare Advantage who made that selection during the open enrollment period. Although there is an extended open enrollment period, how many went into the Medicare Advantage program? What we know is that in 2022, we went over the threshold and a majority of Medicare beneficiaries chose Medicare Advantage. We know why they're choosing Medicare Advantage. The reasons why are, number one, it's less expensive. When you're talking about people who are 65 and older, the median income is approximately $40,000. So to choose between Medicare Advantage, where oftentimes it is a low or no premium choice because they're making their money off of the Medicare Trust Fund, is and also is a lot simpler, where they don't have to deal with purchasing a Medigap insurance or Medicare Part D. People are making choices based on what they can afford. Now, there are people that are also choosing Medicare Advantage who could afford traditional Medicare because they like the dental, vision, and hearing benefit, or they like the gym membership, or whatever it may be. But what we do know is it is disproportionately impacting people of color who are more likely to be low income beneficiaries, and they're going to go with what's going to cost them less. They don't understand that once the complex conditions happen, they're going to find themselves weaponized by the prior authorizations that are required by the limited networks. We have found that appealing to them in terms of the overcharging, the upcoding, and stuff like that really doesn't resonate with beneficiaries who are making economic choices or choices that they think will benefit them better. Clearly, Medicare Advantage is very bad at a policy level for the Medicare Trust Fund. Per beneficiary, it's 6% or more expensive than traditional Medicare. But what we do know is people are making choices oftentimes based on economic necessity, which led us to develop a program that we think that calling for an end to Medicare Advantage is a bad idea, because what it does do is it alienates the people that are on Medicare Advantage who feel like they're getting a better deal. What we think we have to do is give people a genuine choice. So we have arrived at a strategy which we call leveling the playing field. And leveling the playing field has 3 components to it. 1, eliminating the 20% copays in traditional Medicare and capping out-of-pocket expenses. 2, adding benefits to traditional Medicare like vision, dental, and hearing. And then 3, eliminating the overpayments and excessive administrative costs of Medicare Advantage and using the money that would be saved to help pay for the benefits that would be added to traditional Medicare. We are doing a number of things in pursuing this strategy. Number 1, what we're doing is we are issuing, by the end of this month, a Medicare primer. The Medicare primer basically lays out what has happened to Medicare and how there has been a corporate takeover and what the implications of it. It ends with a very, very good article by one of our members, Dr. Jaysri Lingappa, about why Medicare Advantage beneficiaries have an interest in leveling the playing field. And it goes into some of the data that's been developed about what happens to people when they develop more serious conditions in the Medicare Advantage program. So we are putting out this Medicare primer. The forward has been written by Representative Jayapal, who we work very closely with, as she's one of our members. And she's written a wonderful forward to the primer. We're going to be sending the primer to every member of the Congressional Progressive Caucus. We're going to be sending it. Our plan is to send it to every Democratic state organization in the country. We plan to share it, obviously, with our entire congressional delegation. And we're going to make it available to anyone who wants to use it. The other thing that we're doing is we have drafted a letter to President Biden and to Secretary PSARA. And here, let me pull it out so I can say exactly who it's going to. To Chiquita Brooks, the LaSure, the administrator, Senator Chuck Schumer, Representative Hakeem Jeffries, to the U.S. House Minority Leader, the Senator Elizabeth Warren, and Representative Pramila Jayapal. And this letter basically lays out the case for leveling the playing field. Now, what we have going for us is that on December 7th, 2023, President Biden, in a White House press event, talked about the necessity to level the playing field between Medicare Advantage and traditional Medicare. He actually used the term that we developed a year ago. We are congratulating him for that language, but we're saying now it's time to actually make it happen. And these are the things that need to be done in order to level the playing field. This letter is that we have written to President Biden and the people that I mentioned. We're going to be circulating both in-state and out-of-state. And we're going to ask organizations from all across the country that we can contact to sign on to this letter. We hope to send the first version of the letter with the original sign-ons. We hope to send that sometime in the next month because we think that it can be injected into the presidential campaign that's coming. But we also intend to keep circulating it up through Labor Day, adding signatures of organizations from around the country, urging him to level the playing field between traditional Medicare and Medicare Advantage. So our campaign is made up of those two things. We're also meeting with our congressional representatives. We met with Representative Adam Smith from the 1st Congressional District, the 9th Congressional District. We had a meeting yesterday with the Chief of Staff for Representative Strickland, Marilyn Strickland, who is in our 10th Congressional District. And we go into those meetings talking about two issues. One is leveling the playing field, introducing them to the concept and asking them for their support for leveling the playing field. And the second thing we do is ask them to pledge to vote against the Fiscal Commission. Those are the two things that we do. We are not, I just want to say, because I know a lot of you are actively circulating Pramila and Senator Warren's letter, which is now on the Senate side, Senator Warren and Senator Brown, and on the House side, Representative Jayapal and Representative Schakowsky, and I forget the third person, but you all probably know who it is. When we meet, we'll mention the letter, but we think the letter, we try to, our experience, I came out of lobbying. Our co-president, Jeff Johnson, who was the president of the State Labor Council here, came out of lobbying. And what we discover is when you ask them for something, then when you go back and ask for something else, they say to you, hey, we already did something. What is this? Why do you keep coming back to us? So we want to make sure that what we ask them to do is something that's definitely going to impact policy. We think that it's all well and good to expose the abuses of the Medicare Advantage program. It's important to do that, and we think it's very helpful to do that. Our goal is to eliminate Medicare Advantage. And Wendell Potter has said that if we actually succeed in leveling the playing field, we will ultimately wipe out Medicare Advantage. So that's the strategy that we are employing. David Lau, do you want to add anything to that?
No, not right now. You did a good job. Let's see what questions people may have or other comments.
Sure. I'll stop there, Mike. Chuck, I'll stop.
Cheryl has her hand up.
Yeah, hi. Thanks. I guess it's out of the question to ask anything about raising reimbursement rates for traditional Medicare. I'd love to have a little bit of history on how that got so badly shelved, and it's why is it hopeless when the rest of these other things seem pretty idealistic too?
Cheryl, I hear you. And I recognize that the reimbursement rates aren't adequate. We think right now, honestly, that we're facing a very short timeline for the total corporate takeover of Medicare. And so we have got to develop a strategy that undermines that takeover. I mean, we have Humana leaving the private market to totally focus on Medicare. You've got United Healthcare creating this vertical presence that allows them not only to collect money from the Medicare Trust Fund for as a result of their upcoding and their delays and denials, and we've been developing personal stories around that, and we work with Be a Hero on that. But they also get reimbursement from the medical practices that they're purchasing. So they have it coming and going. So we're really focusing on trying to undermine the corporate takeover of Medicare. That's where we want to focus on that.
Oops.
Like a laser.
I got it. Thanks.
So,
Ann, you want to go next?
No problem. Oh, I had two questions for you. All agree with all of this. The Warren Jayapal letter, which is now something else, has a paragraph at the end making similar recommendations. Is that the same set of recommendations that you're making? And are you preparing a tool that explains this in a clear, succinct way that we can use to educate advocates and also educate members of Congress?
So you're asking if we have a one-pager that explains
Something like that, yeah.
David, I don't think we've developed that. Is that right? I mean, there will be an explanation of it in the primer. And what we do have, which I think is more of what you're talking about, we have David Loud did an excellent job of leading an effort at the last meeting of the Washington State Labor Council convention, our statewide convention, that passed a resolution calling for leveling the playing field. Rose Roach, who Carol, you've worked with or are now working with, took that resolution, took it to the Minnesota AFL-CIO.
Right, and they passed it.
That's right. So what we're doing is that resolution will be part of the primer. And the letter that we're sending out, inviting organizations to sign on to this letter to the president, and also is accompanied for those organizations that are interested with the resolution, with the opportunity to pass the resolution. The resolution is full of information, as well as laying out specifically what leveling the playing field means.
Approximately when can we expect?
I'll get it to you as soon as you want me to. I just need the email addresses. We're circulating it right now. So I just basically, let me give you my email address and you can email me and I'll get it to you. My email address, and I'll put it in the chat too, but I have a hard time putting stuff in the chat and talking to. I can walk and chew gum, but I can't do that. The email address for me is Robby, ROBBY, .stern, STERN, @gmail.com. And we'll send you the letter, the sign-on letter, and we will send you the resolution.
And Robbie,
David.
I think Ann may have also been asking, when is the primer going to be available?
The primer's going to be available the end of this month. Mary,
I'm a little slow taking notes. Could you just repeat the second aim of the leveling of the playing field? I
Sure.
didn't get it.
it's adding benefits to traditional Medicare, including vision, dental, and hearing. So the first is eliminating the need for Medigap insurance, eliminating the 20% copay,
Right.
and capping out-of-pocket expenses, and then funding it by clawing back the overpayments as well as the excessive administrative costs and the results of the fraud and abuse that have been documented at this point
Okay.
by these
Yeah.
Medicare Advantage plan, and using that money to help increase those benefits. Now, listen, we know it's a high hill to climb. I'm 80 years old. I've been around for a while. I understand this is a high hill to climb, but I also have learned that if we don't put it out there, it ain't going to happen. So we just got to organize like crazy to make it happen. Mary, did that answer your question?
Yeah, it does. But do you have a feeling about why they're not being more aggressive or why they're not getting this money back? I mean, every once in a while I see a report that somebody's been fined millions of dollars and they're paying up. But how come they can't get these billions of dollars back?
Well, because those corporate lobbyists are very powerful, number one.
Okay.
Number two, CMS is infested with people who go back and forth between the insurance industry and public service. The woman who is the head of CMMI comes out of the insurance industry. And, so there's a whole variety of reasons, but basically it's only going to happen if we build the kind of movement that demands it. And we know that.
Okay.
We've had enough experience to know we have to build this movement to make it happen. It was astonishing to us that President Biden used the language level the playing field. It was like, holy shit. That message is truly getting out there. Now, he didn't do anything to do it, but it was pretty amazing that he did it. He mentioned those words. Ken, you could go ahead.
Thanks for the lowdown, Robbie. I have two questions about strategy in meeting with our representatives or senator or staff. By the way, that staff is also part of the revolving door. They go out to lobby for the health
You're right.
industry
Absolutely.
after they work for the senators or whatnot.
Absolutely.
So number one, do you think there's any value in bringing up with our representatives to reminisce about what happened with the for-profit HMOs in the 1990s, the public disgust that rose about prior conditions, pre-existing conditions, and the fact that we're heading in that direction with these managed care for Medicare, number one. And number two, is there any value in raising the fact that subsidies to the contracts for Medicare Advantage are actually raising the premiums for those of us on traditional Medicare? So in addition to all the other points that, yeah.
So, I heard you say you have an hour meeting with one of the staff and a half hour with the other. That's a lot of time. So I don't see any downside to talking about this is just another recreation of managed care. They're going to get lots of heat around that. I don't see a downside to that. When we had our half-hour meeting with Representative Smith, that was not one of the points we made. We felt that it was really important to come in with personal stories. So we did that. We brought in people who had personal stories to tell. The fellow we met with yesterday from Representative Strickland's office, our chief of staff, he is a guy who came out of college and immediately went to work for Congress. He's now in his 40s. He's jaded. He's just cynical and jaded. He's ready to go out to pasture and start lobbying. But we continue to bring the stories in. We told him a story of one of the constituents of Representative Strickland was there and told their story. And then we just laid out, hey, Medicare Advantage was created with the idea that it was supposed to increase quality and decrease costs, and it's done just the opposite. It's decreased quality and increased cost. It's not working. We need to level the playing field. Let the market decide, level the playing field, and let people choose which one they want to be in.
Thank you.
Carol.
Robbie, just to be clear, this effort is being organized by PSARA and then with sign-ons from other organizations, or who is putting this forward?
Well, PSARA is initiating it. We're inviting other organizations to circulate it to their organizations. I mean, we're we're this small little organization. We only have 1,400 members. We're this small little organization out in the left-hand corner of the country. We recognize that. We've been fortunate, excuse me, we've been fortunate to be hooked up with some national organizations like PNHP, like Be a Hero, like Social Security Works. We're asking people to take the letter and circulate it. We're not looking for credit on this. We want to have a letter filled with organizations from all over the country.
Right. Okay, but I think strategically, the fact that it's coming from a group of retirees asking to and using the language of Biden to level the playing field is brilliant. It's not coming from a bunch of wonky PNHP people or I don't know. I think it's brilliant. I think people are likely to listen to pay more attention to something when it's coming from senior citizens who they also know are a big voting bloc. I'll stop there.
That well, I kind of hope so, Carol, but I got to tell you, PSARA is not just retirees. PSARA is actually multi-generational and also multiracial. Our leadership is primarily seniors, but we have a number of younger people who recognize how significant this struggle is going to be in their lives as well. But I guess I want to emphasize the point, Carol. We send it to you. You can circulate it. There is a way that you can just go. What happens is you'll get the link so that it takes you to the PSARA website and people can sign on. There's a Google form there they can sign their organization on, and they can sign as individual leaders. And so, and we just, for us at least, the importance is getting a lot of organizations and individual leaders from around the country to sign it. That's what we're aiming for. Does that answer your question, Carol? Okay, good. Paula?
Yeah, a quickie. The primer that you're going to be sending out, this is going to outline the strategies of leveling the playing field. I just want to get that.
That's one of the things that the primer will do. The
Okay.
primer gives an analysis of how we got to where we are now.
Okay.
It's actually, Paula, the primer is made up of front page articles that we've been running in our newsletter. We put out a 12-page newsletter. It's both printed and and electronic. And so it is a combination of the front page articles that we ran throughout 2023 and in the 2024 piece that was addressed to Medicare Advantage beneficiaries. It lays out what has happened. It lays out the strategy of leveling the playing field and explains why every one of us has an interest in doing this. That's what the primer does.
Okay, great.
And it's going to have nice graphics. It's going to be, I think you're going to like the look of it as well. I should mention one other thing that we're doing here real quickly. And then I'll come back to the questions. I forgot to mention this. We've been running a series of webinars, and we have a webinar coming up on April 2nd. And the webinar is, oh gosh, I can't believe I can't remember it's Fear and Loathing in the battle to level the playing field, something like that. And we have 5 people who are going to be on a panel discussing where are we now and where do we need to go. They are Wendell Potter, Ed Weisbart, Rose Roach, David Lipschutz from Center for Medicare Advocacy, and Spencer Carnes from Be a Hero. And so it's going to be a panel discussion of where we are now and where we need to go. And we're going to have an electronic flyer for that we're going to be sending out sometime in the next 3 or 4 days. And it's on April 2nd at 5 p.m. Pacific time. And we'll get that to Mike and Chuck, and you can circulate the flyer to the people that are on this.
I just want to interject that we should make the next two questions fairly quickly, because Chuck has important announcements also.
Okay, Ann and then Mary.
Oh, so one more thing. If you all or many of us heard Warren George's economic analysis of costs and the healthcare in our current healthcare system related to why the public option is not a good idea. But in there, he mentioned that Medicare is really very underfunded right now. And so it does cost taxpayer dollars in addition to FICA tax money. And I wonder if that's a danger to us. It's something the conservatives can use against us. And there's probably not enough money that we can take out of costs, even if we reduce administrative costs, even if we reduce fraud, even if you reduce the cost of drugs, et cetera, to make up that gap. And does Medicare need to increase the FICA tax to fund it properly?
I think that it probably does, and I think it probably does need to increase it slightly. I mean, the fact that that money has come out of the general fund to fund Medicare is not new. That's been going on since Medicare was created. But yeah, I think that it probably needs to be done. But the amount of money that the overpayments to Medicare Advantage are somewhere between 88 billion and 140 billion dollars a year. That's real money. I mean, that's real money.
It's enough to improve benefits for sure.
You bet it is. You
but
bet it.
I just think in the long run, since we don't have Medicare for all yet, and we don't have control of healthcare costs at all.
Right. But we're not going to address that. We're not
Okay.
going to address that now.
Okay,
I mean,
I'm just worried that the fiscal commission notion can use that against
there's no question that they
safety
will.
net programs.
Yeah, there's no question that they will. I mean, they hate Medicare anyway.
Anyway.
Right. So this is they hate Social Security. I mean,
Oh my
Social
God.
Security is totally self-funded. There's an
Yes.
easy fix, scrap the cap or
Scrap
raise
the cap. Yeah.
That's
right.
right. That's all they got to do.
Yep.
I don't know if any of you have seen our rap video on Scrap the Cap, but
No.
if you Google Scrap the Cap, we have a rap video that PSARA put together with one of our allies here. That's been out. It's on YouTube. It's called Just Scrap the Cap. Mary, go ahead, Mary.
Yeah, I don't know how often this happens, but our PNHP chapter here in Sonoma and Napa has joint meetings with Healthcare for All California. In fact, the lady who represents that locally is the president of the California organization. And I was just wondering if you've reached out to Healthcare for All for support.
We have Ronnie Shore, who's on this call, is the president of Healthcare for All Washington.
Oh, okay.
So we're going to count on Ronnie to reach out to the other Healthcare for All organizations. Ronnie, I know you're off screen, but we're thinking about you, brother, and you're taking that role. Yeah, but all of you that are in organizations are welcome. Local organizations are welcome to sign on to this letter. And we have reached out to Ed Weisbart to try to get national PNHP to sign on to the letter that we're going to be circulating, but we welcome local chapters of PNHP. I'm sure that PNHP Washington is going to sign on, and we'd love to have other chapters of PNHP sign